And so our beloved Dr. Villagomez has kindly agreed to share some of her knowledge with us, particularly on the use of broad spectrum micronutrients. So I will give this over to her.
I enjoy speaking about broad spectrum micronutrients because I think that the evidence base is so strong. And I find it one of the most powerful interventions for child mental health. Quite, I wouldn't say easy, but easier to learn. I talk to many pediatricians regularly with who I'm sharing a patient with, and can easily inform them why I've chosen the modality that I did. So just briefly regarding nutrition, I think we all know that we're not eating, and especially teens and children are not eating the foods that they need. And there's several studies, this is just one of them, showing that there's a direct correlation between not eating well and feeling poorly. Many people say, well, if you're not feeling well, then you're going to eat poorly. And this specific study really highlights the fact that that relationship is bidirectional. If you're not eating well, then you're also not going to feel well, even if you're baseline doing okay. So I know for myself, I've been making a bowl of 9 fruits and vegetables in the morning and then just snacking on them the entire day to help my immune system. But I think that that's something, again, so many different studies show this. And this one highlights that the reverse causality, meaning that if you're not feeling well, you're eating poorly, it does not explain the full effect of the influence of nutrition on mental health. The other thing that I think is important to mention is that as a child psychiatrist, I talk to kids a lot about eating well, and I say, I want you to eat well 80% of the time, and then 20% of the time, eat your favorite foods. Because I do think that there can be a risk of just focusing on healthy foods, as I do see kids develop eating disorders as well as orthorexia when we just focus on just healthy foods. And interestingly, a study done in 2012 shows that the quartile that they divided up the participants in how well they were eating in 3 different quartiles. And the one with the best eating and the one with the second best eating were equivalent, but they did a lot better than the ones who were eating the worst, lots of junk food. So I took the takeaway message I get from that is you don't have to have a perfect diet. As far as with kids and with adolescents, you just want to have like a pretty good diet. So I talk to kids, 80% of the time eat well, but unfortunately, I think it's the reverse that we're actually seeing most of the time because kids are eating, this is no news for us. We have the standard American diet. I do think that there's an issue with, and the data supports this, that we're not getting enough of the calcium, magnesium, zinc that we need. And even if for a variety of reasons, including food deserts and school lunches and lots of different factors involved. And also that this is something I tell all the parents when I'm prescribing micronutrients, is that the fruits and vegetables that we're eating today don't have the same amount of mineral and vitamins that they did 50 years ago because of eating out of season, because of the agricultural changes. And to me, this is a big, big piece of why micronutrients help so many kids, even the ones that might be having an okay diet. This is a fantastic review article, and basically the take-home message to this is that we've spent a lot of time in academia researching a single micronutrient. Let's look at folate, let's look at chromium, let's look at magnesium, and all the studies, when you look at just one micronutrient, has usually a small effect size. But when you look at the studies using broad spectrum micronutrients, the effect size is usually more of a moderate effect size because you're giving the body a variety of minerals and vitamins and minerals and allowing it to use what it needs. So these are the 2 studies. There have been, where I use micronutrients the most are in kids with mood dysregulation. And we see that a lot with kids with ADHD. I'd say one of the primary things that I see in my practice are kids with ADHD who have been started on a stimulant. They're doing, better with focus and attention, but they still have severe mood dysregulation. And I also see a lot of kids who can't tolerate stimulants, and they get worse. And pretty much I'd say about 80% of the time in my clinical experience, and the data shows this a little bit lower in research studies, about 60 to 80% of the time, do you see significant improvement in mood dysregulation, attention, focus, hyperactivity. So these are two of the there was first an open label study showing improvement with micronutrients, and that was followed by a double-blind placebo-controlled trial in children using micronutrients with improvements in this over here, improvement of CGI scores. And again, the main thing I see improvement with is emotional dysregulation and aggression as well, although many improve in attention and hyperactivity. There is currently a second, which is very exciting when you have two, this is the second study done in children, a double-blind placebo-controlled trial showing preliminary results of also the same improvement in mood dysregulation in children. And also there's a study in adults with ADHD, also a double-blind placebo-controlled trial showing improvement in ADHD symptoms. So there are these different studies here. Interestingly, they looked at, in this study, the children who were given the broad spectrum micronutrients in the ADHD study showed an increase in the diversity, of the bacteria in the gut over the 10 weeks, which researchers did not see in the group exposed to placebo. So there are many studies coming out looking at probiotics, and I think right now the conclusion is we don't know exactly, there's not a consensus of what probiotic we should be recommending to patients and in what type of patient it might be helpful for and how many strains and what strains those are. But I think that in this study, they actually gave micronutrients and they showed an increase in the diversity of the bacteria, which many researchers will say, you know, even though we don't know exactly what type of bacteria probiotics might be helpful, the end goal is to increase the diversity of bacteria in the gut, and that's a reflection of the health of a gut that's more healthy. Okay. As far as adverse effects, most kids tolerate them quite well. If the kid is on medications, there can be significant drug medication medication nutrient interactions. So that's a big piece. The micronutrients actually, what they call, can potentiate the effects of medications, which means make them more strong or make them stronger. So there's some definitely skill to learn about how to manage both of those things together. But in the studies looking at just monotherapy with micronutrients, the adverse effects were minimal and well tolerated. There are specific contraindications, and these graphs, or this table, comes from the article written by Charles Popper that I showed earlier in the presentation. And I think that they're becoming more and more accepted, broad spectrum micronutrients. There was recently an article published in the Psychiatric Times. Also, they had a podcast on the Charlotte Report, or the Carlet podcast, and there's a great TED Talk on it as well. So I think that we're seeing more and more press about this, and as we get more studies, especially as the second double-blind placebo-controlled trial for ADHD comes out in kids, I think we're going to see even more about this. There are two companies that sell broad-spectrum well, there's several, but the two main companies that sell them that have been researching this have their addresses down there for further information. And so I could speak about this for quite a long time, but I'll pause there because there's many other things that we could talk about today.
Thank you, Amelia. Any questions or comments for Amelia on this topic, and or any other questions that might be on people's minds? Feel free to speak up or put them in the chat. We use the broad spectrum micronutrients quite regularly in our clinics, and our fellows and residents can also share about their experiences with patients or with themselves. A lot of people are taking them and coming and telling me about their experiences.
I will go ahead and fire out. I mean, I was just wondering what's your go-to of the two major, companies. What do you usually prescribe, and when and what's the cost? And
yeah, I'm happy to talk about those things. So first of all, I'll say a disclaimer is I have no financial interest in any of the companies. In fact, all the researchers doing research on the broad spectrum micronutrients do not get paid by the company. So I think this is it's a very cleanly studied intervention. And Dr. Bonnie Kaplan, who's an amazing researcher, speaks about really the fidelity of this work. As far as what company, I personally recommend, I think I tell parents about both of them. However, most of the parents choose to go with the True Hope because the dosage is twice daily as opposed to the DEN, which really needs to be, according to the researchers, needs to be dosed 3 times daily. Of note, though, the ADHD study that was, they used to be one company, and they split several years ago. So the ADHD study was actually done with the DEN product. So I think that there are small differences between the two. So that's a caveat to this. As far as the price, that's another reason I go with the True Hope, because I think it's a little bit less. There's the advanced formula, and usually the dosage for like an 8 or 9-year-old kid who's is usually 2 twice a day, or maybe 3 twice a day. So in the latency age kids, maybe the teenagers, maybe more like 3 twice a day, or 3 in the morning, 2 in the afternoon, something like that. And then the price, I'd say, depending on a bottle of 120 capsules, is $49.95 if you as a psychiatrist create an account, and then the patient will receive I think it's a 20% discount or 20 or 30% discount. And I tell all my patients I don't make any money off of this. This is something that I'm just doing as a courtesy. And so and part of the reason that they have that discount available to patients is that if the patient calls, they're not going to give clinical advice to that patient if they're under your account, versus if they're just calling in and buying it. There are people there that will help them navigate how much to take, and et cetera. And so were there any other questions you had? Were those the things? So the question is from Becca: have you been using the stimulants indicated for all children with ADHD, or just those who cannot tolerate stimulants? No, I use for both. In my experience, if a kid has still, a lot of kids will come to me maybe on 54 of Concerta, and they'll still have dysregulated mood. What we'll do is actually we'll start the micronutrients, and usually we'll be able to bring that Concerta dose down to about half. So we'll usually be able to bring it down to 36 or 27, and the kids are eating better, which is great. And they're needing less medication, which is great. And their mood is better. And we do a cross titration. So it actually has to be done kind of carefully. And because kids can get worse, right? So if you're giving them the medication and the micronutrients, there can be this potentiation, and it can get worse. So I talk to parents a lot about that, kind of having a sense of when that might happen, having them check in. And again, this is just a short talk. We've given we've given lots of talks about this. So there's certainly a nuance to it. There is a chapter in this book here, Complementary and Integrative Treatments in Psychiatric Practice, that goes into more detail about it, as well as Nusheen and I teach about it through the Integrative Psychiatry Institute that Will does, and the Andrew Weil Center for Integrative Medicine has a module on integrative mental health, and we've done a section on broad spectrums there as well. Okay, so any insurance companies, no, they unfortunately don't reimburse it, but like Nusheen mentioned, there are the HSA, patients can buy it using their HSA card. And Jesse also mentions so many kids who tolerate taking the lightning stick initially because their parents make them, but they don't like the powder or the taste. Then the parents get sick of the battles and let the kids stop. When I suggest transitioning to the pills, the family's pretty much done with the trial, want to talk more about meds. Any tips? Yes, it is hard, and this is what the research, the Maddie's trial showed this as well, that it's hard to get kids to stay on these. It can be hard to get kids to stay on these because it's just a lot of pills. So a couple of ways that we work on this is you can actually open the capsule and put it into yogurt or applesauce. I find that really helps a lot of kids and families because I've tried it myself. I personally can't taste it if it's an applesauce or yogurt. I use it personally as a multivitamin for my 2-year-old, and at a very, very low dose, and like half a capsule, and I put it in her oatmeal applesauce and yogurt every morning, and she's never complained about it, although she complains about many other different food choices. So I think that's been a really powerful one. And I think the other big piece to this is it helps certainly ADHD, mood dysregulation, but it doesn't fix family dynamics. And I think a lot of times we see kids with ADHD who also have comorbid ODD. And so I think that certainly is a complicated factor. It's not the end all be all of everything, but I also notice over time we can decrease the amount of micronutrients, the dosage. So usually a kid might need 2 twice a day in the beginning, and then over time we can decrease it. The other way you can decrease the dosage is if they start eating better and healthier. So we talk about that as well. Lydia asks, what is your opinion of patching aspects of the broad spectrum micronutrients by doing B-complex, magnesium, zinc? Often patients come in with their own combinations already. Excellent question. Hear this one all the time. I think if I personally haven't had any success in patients doing that. And I don't think that's where the evidence base really shows us as far as patch mealing them together. I do see that, I think that the big piece about is how the broad spectrum micronutrients are chelated. And it's chelated, the chelation really affects the absorption. So if they're just buying whatever thing over the counter, we don't really know how much of that is being absorbed. And I think that's the biggest piece. In fact, there was a recent study, and I can send that to you, looking at absorption and looking at chelation amongst these different products. Bonnie Kaplan sent that to me recently. There was this exact question on the Facebook group, and that was her response. So I'm happy, I'll put that in the chat box as well. I've been able to have children take, yes, certainly you can, if you can stick it into a smoothie, that's great as well. And Nusheen also answered with broad spectrums are chelated and better absorbed and have research behind them. It is crucial for children on the autism spectrum to have supplements since they often refuse to eat vegetables. Yes, and I see, interestingly, kids who are on the autism spectrum, as we know, they are very sensitive to medications, and you kind of have the dose exactly right. I find in my clinical practice for kids who are on the spectrum, if you're giving them a stimulant and you're 10 milligrams too high or 5 milligrams too high, you see really difficulty. And then if you switch it just a little bit, things improve quite a bit. And I see the same thing with micronutrients. I had one kiddo who was taking 4 a day, and we switched it to 5. And then all of a sudden there was a huge explosion of mood. We switched it back down to 4 and things were a whole lot better. So I've noticed specifically kids on the spectrum, just like they're sensitive to medication changes, they can be sensitive to the micronutrient dosage. Jana mentioned some of my struggles with the broad spectrum micronutrients, specifically the sticks. Are parents thinking these are the same as emergency packets, so they frequently let their children be in charge? Yes, with the administration. Then I have, yes. I think that's a big piece. A lot of times we think that vitamins are just, take it when you want to, and it tastes good or doesn't, I think that there is quite a bit of education that goes into this as far as talking about how this is really an approach that has to be done judiciously. I have a patient that I just saw the other day who was taking the lightning stick, sometimes at 8 a.m. and sometimes at 6 p.m. And then if she took it at 6 p.m., she couldn't sleep because there were B vitamins in there. They were energizing for her. So I do think that just like we talk about medication with risk, benefits, and alternatives, I have a handout that I give to all the patients with all the TED Talks on there. And I really go through a lot of information with them so they understand this can be as effective as medication, and it has a large effect size. So we have to be careful with how we do this. And I certainly I document all the time that this is a non-FDA or an off-label approach, and has not, so that's just for documentation reasons. Okay, Bettina says, if the family cannot afford True Hope, have you been able to get MCO? I'm not, what MC, is that Medicaid or Medicaid? MCO is Medicaid?
Managed care
Managed care organizations. Thank you, to have for any supplements. I'll let Nusheen speak to that one. I haven't had success, but maybe Nusheen.
Yeah, I already responded. So my only success has been with the HSA, HSPs. I know in New Zealand, the government has started to actually support the supplements as part of their insurance plans, but not in the US as far as I know. And also Cynthia's question about how long do they have to take
Oh.
them to see benefit?
It really depends on the health of that kid's own microbiome, right? So if the microbiome isn't healthy, they're going to have a harder time absorbing the nutrients. So there might not be any effect unless you really address the microbiome. And so there's some art to that as well. I've seen kids respond as quickly as 1 day, within a day on the lightning stick. And the broad spectrums, like an average kid, I'd say with ADHD, who's dysregulated, who's on a stimulant, I'd say about a week or two is usually when I notice the improvement. And I don't give up unless they've been on it for about 8 weeks, 6 to 8 weeks, without an effect. At that point, I say, okay, let's try something different. So we could speak on and on about this, but I also wanted to make sure that there's time for anybody wanting to bring up issues around integrative psychiatry in their residency programs, what people are doing. If anyone has questions about what we're doing at the U of A, wanting to open it up, we really want to offer this as a forum for anybody who has questions about expansion of integrative medicine in academia.
Thank you, Amelia. And we can continue to respond to questions on chat, but if anyone has any curriculum related comments or questions, I would love to leave some room for that, as Amelia said. Yeah, go ahead, Lydia.
I just want to say, just wanted to comment that I appreciated some of the free courses that have been available from University of Arizona recently. And so we've put together kind of a document to our whole department on both the kind of self-care free resources that are coming up from a lot of the leading organizations, like Academic Consortium has put resources for providers, and then, Center for Mind-Body Medicine and our Center for Spirituality and Healing has a page, and, kind of tied those resources with opportunities to learn more about integrative medicine, because some of the, as you're learning, you're also learning it for yourself. So that's been really nice to have this. So I want to thank you for that, especially as, we have coronavirus. And we had a comment from the residents, particularly the ones that took our course, their first year and second years. And now they're not inpatient, they're remote. They do some rounds remotely, but they're finding themselves having a lot more free time and kind of itching to do things. So this has actually been kind of opportunity for them as they especially as we finish the course, to offer these other options for them to continue the conversation and the learning.
Thank you. That's great.
Yes, I feel like these days my volunteer job on the side is posting and sharing free resources. So it's nice to actually have resources to share.
Yeah, thank you for doing that. It's been just so nice to have it at fingertips,
Great.
Dr. Runchbar, I wanted to add something. Is it okay for you to comment on labs significant for integrative psychiatry and how some of those labs are not covered by insurance and how we can overcome this? Because I frequently had patients coming complaining, oh my goodness, my lab bill is $800 or something like that.
Absolutely. So, I think it's really important to code as many symptoms and diagnoses as possible to go with the labs. So, for example, if you have a patient with generalized anxiety disorder and you order, an entire slew of B12 and D and zinc and magnesium and all these different things that normally the current standards of practice do not include getting all of those labs for anxiety, then the chances that the insurance company is going to send it back or charge them extra is a lot more. However, for the same patient, if you add chronic pain, abdominal pain, nausea, dizziness, diabetes, autoimmune disorder, headaches, if whatever else you add to the codes that go with the lab, the chances that the insurance will cover are exponentially higher. And I think that we see that all the time, but I'm happy to hear from anyone else who's had experiences with insurance lab issues. Because I think a lot of times, in integrative psychiatry, we realize that we need these things because we care about the optimal functioning of the entire system. However, unless you really spell out a lot of these other symptoms, then somebody's going to find fault with, why do you want to know what the RBC magnesium is, if all they have is depression or whatever, and they just don't get it. But I think it also speaks to advocacy and how we need to continue to show the data that various micronutrient deficiencies do affect mental health. But obviously that takes way longer for things to change on a policy level. Any other thoughts about that or anything else? Bettina, for the children I see who are at risk of malnutrition or lead poisoning, I can get labs covered, and the ones that are adopted. Do you mean that Medicaid is easier on some of these issues versus private insurance, or?
Yeah, so if you don't know the genetic background of the child, then my argument with the insurance company to get, because it's to get the MCO to cover it is because it's part of the health benefit. It's not the mental health benefit, but it still is a health benefit. If you don't know, how their mitochondria is functioning, the argument is maybe they are, deficient in folate because, they have an inherited genetic defect. So for adopted children, I can get pretty much everything covered under both Medicaid and also, medical assistance and even the private insurances.
How do you code?
So I code for it that, I actually put down that, we're trying to figure out, would they need a mood stabilizer medication? And if it's a mood stabilizer that's Tegretol, not that would be my first choice for children, but then they'll cover it because if you are, folate deficient, you're also going to have a problem metabolizing Tegretol, and it could kill you. So, they're basically brass tacks on that. And, so lead testing, though, is actually harder. So for children in my practice who are not, at risk of, so the way it works in my area is they go by zip code. So like they know the zip code where your patient lives, and they know if that's a hot area for lead poisoning or malnutrition, food insecurity, which leads to malnutrition. So if they're not, then I'll get back a rejection letter saying, they don't want to pay for it. So, but if you can say that the child has pica, for example, so I will sometimes they really do, they are putting things in their mouths that are not, so, we know they're probably doing it for a psychological reason. It may not be a nutritional reason, but hey, I don't know. So I want to know what's going on. So that's how I've been able to get it paid, because apparently for lead testing, it generally they won't approve it for children over the age of 3 in my area.
Mm-hmm.
They just have a blanket rule. That's how these insurance companies work. They just have a rule for something, and, it's not individualized care. It's just, it's ridiculous. Anyway.
Thank you. Well, thank you all for this very rich discussion. Take good care and stay in touch.